Hey guys, Frank Cawley again here today behind the scenes so I can share with you some very good information on a very common problem that we see in the clinic, which is rotator cuff tears or rotator cuff tendonitis/bursitis. So we're looking at the backside of an individual from an anatomy perspective right now, and on that left side where it's highlighted, that is a muscle known as the supraspinatus muscle. The supraspinatus muscle runs across the top of the shoulder blade and attaches into the upper aspect of your arm bone or humerus bone. The supraspinatus muscle is responsible for lifting your arm or assisting in lifting your arm up overhead. So when folks come into us and are complaining about shoulder pain, there's some very simple tests that we can do along with hearing about the mechanism of injury of how someone might have injured this to determine which rotator cuff muscle is involved, the severity of it, and the degree of possible tear if in fact it is a rotator cuff tear. So for example, if someone was to present to us with a rotator cuff problem and going through an examination, they are complaining with overhead movement and different positioning as being bothersome, we would test out these things and compare both sides, and then we would basically do a specific test called the drop arm test, where a person brings their arm up and out to the side, just above head level, and then slowly tries to lower it down to their side. What we look for in individuals like this, and typically we have to help them lift that, what we look for is pain with the movement, inability to do the movement, substitution during that movement, and when they go to bring that arm back down to their side, there's a quick drop in the position of the arm. They may be able to catch it, but they just can't slowly lower it in a controlled fashion. When we see this, we are typically going to be rest assured that someone is suffering from a rotator cuff tear, and we can determine the degree or the severity of that tear based on their limitation of movement, motion, strength, and the test. So when you want to find out if you're suffering from a rotator cuff tear, a lot of times the hallmark test that is provided is a MRI. Now, MRIs are very expensive. MRIs are not given out very freely now at this point in time. A lot of times people have to see their doctor and then go to physical therapy, and if physical therapy doesn't work, or if it's working but not fast enough, they may authorize the MRI. But the cool part for you and for others is that we don't need an MRI to tell if your rotator cuff is torn or damaged or there's a problem with it. Because as I just told you, through the various testing and movements, we can give you a good idea of what's going on with that rotator cuff and which muscle is torn. In the next video, what we're going to do is talk about the degree or severity or grade of tear in the rotator cuff so that you know whether or not you can heal pretty quickly, if it's going to take time, or if in fact you may be a surgical candidate and are going to need to have this repaired. So please stay tuned for the next video, and as always, I appreciate you watching and listening to our information. Thank you.